Okay, so you know the clinical picture. Viral versus bacterial. The scoring systems, the red flags. Now, let's talk about what you can offer over the counter for sore throat. As with the common cold, the first thing to acknowledge is that most sore throats are viral and self-limiting. They'll get better on their own within a week. Your job is to ease the discomfort while that happens and to identify the patients who need something more. Let's start with non-pharmacological advice. Gargling with warm salt water is a time-honored remedy that genuinely helps. About half a teaspoon of salt in a glass of warm water, gargled and spat out several times a day. It helps reduce swelling and can soothe the irritation. Warm drinks, especially with honey, are comforting and can help with pain. Staying well hydrated is important. Cold drinks or ice lollies can also help, particularly in children, because the cold has a mild numbing effect on the throat. Avoiding irritants like cigarette smoke is common sense advice. For pharmacological treatment, let's go through the options. Systemic analgesics are the backbone of sore throat treatment. Paracetamol is first line. It's effective for both pain and any associated fever. It's well tolerated, and it's suitable for almost all patients, including children and pregnant women, at appropriate doses. Ibuprofen is a good alternative or can be used alongside paracetamol for more severe pain. The anti-inflammatory effect of ibuprofen can be particularly helpful for pharyngeal inflammation. Remember the usual NSAID cautions: asthma, gastric problems, renal impairment, cardiovascular risk, and avoid in the third trimester of pregnancy. Aspirin is an option for adults over 16, but not for children, due to the risk of Ray's syndrome. For genuinely severe sore throat pain, alternating paracetamol and ibuprofen is a well-established approach and is often very effective. Local treatments are where things get interesting for sore throat specifically. Medicated lozenges and throat sprays can provide direct relief to the inflamed tissue. Benzocaine lozenges provide local anesthetic action. They numb the throat temporarily and can be very helpful when swallowing is painful. Flurbiprofen lozenges, marketed as Strephin, contain a topical anti-inflammatory and have good evidence for sore throat pain relief. They're available for adults and children over 12. Lidocaine sprays provide topical anesthesia and can be useful, especially before meals, if the patient is struggling to eat because of pain. Hexylresorcinol lozenges have mild anesthetic and antiseptic properties. Antiseptic products are widely available, but their effectiveness is debated. Chlorhexidine gluconate is available as a spray or in lozenges and has broad-spectrum antibacterial and antiviral activity. It can help reduce the microbial load in the mouth and throat, but whether this translates to meaningful clinical benefit for a viral sore throat is questionable. Povidone iodine gargles have antiseptic properties and some evidence for reducing sore throat duration, but they should be avoided in patients with thyroid disorders and in pregnancy. Demulcent preparations, things like glycerine-based lozenges or honey-based products, work by coating and soothing the throat. They're the gentlest option and suitable for virtually everyone. They don't have direct pharmacological action on the infection, but they can provide real comfort. Now a practical point about lozenges in general. Some patients buy them thinking they're just sweets. Make sure they understand not to exceed the recommended dose, especially with medicated lozenges containing anesthetics or anti-inflammatories. Benzocaine lozenges should not be used in children under 12 due to the risk of methemoglobinemia, though this is rare. Let's talk about what not to recommend. Antibiotics are not appropriate for the vast majority of sore throats. Even when a bacterial cause is suspected, current NICE guidelines recommend a delayed prescribing strategy in most cases because sore throat is usually self-limiting, even when caused by Streptococcus. Antibiotics are generally reserved for patients who are systemically very unwell, who have a high risk of complications, or who are immunocompromised. As a pharmacist, if you think a patient might benefit from antibiotics based on Centaur or fever pain scoring, refer them to the GP rather than trying to manage it in the pharmacy. Special populations. For children, paracetamol or ibuprofen, for pain at the right dose for their age and weight. Warm or cool drinks. Ice lollies. Lozenges can be a choking hazard in young children, so they're generally not suitable for those under 6. Hard-boiled sweets can be used in older children as an alternative. For pregnant women, paracetamol is safe throughout pregnancy. Ibuprofen can be used in the first and second trimesters, but must be avoided in the third due to the risk of premature closure of the ductus arteriosus. Antiseptic gargles and sprays should generally be avoided unless specifically cleared for use in pregnancy. Warm salt water gargles are the safest option. For elderly patients, be mindful of NSAID cautions and check for interactions with existing medications. For patients with diabetes, sugar-free lozenges should be recommended. Counseling summary. Reassure the patient that most sore throats resolve within 1 week. Recommend paracetamol or ibuprofen as the most effective options for pain. Offer topical sprays or lozenges for additional local relief if symptoms are particularly bothersome. Advise warm salt water gargles, warm or cool drinks, and rest. Set clear return to pharmacy criteria. Come back if symptoms haven't improved after a week. If they're getting worse rather than better. If they develop difficulty breathing or swallowing. If they can't open their mouth, or if they develop a rash. That wraps up sore throat. Next, we're moving on to our final condition in this module, rhinitis.
This video was brought to you by Pharmacy Skills. If you enjoyed this video and want to see more like it, Pharmacy Skills offers a comprehensive animated learning library covering the BNF, MEP, and general pharmacy training. Each video also includes practice questions and a range of revision tools to help support your learning. Visit us at www.pharmacyskills.com.